Welcome back to RN Toolkit. In this video, we'll cover common topical medications used in skincare and wound management. We'll review skin prep agents, antipyretic drugs, corticosteroids, antifungals, topical vasodilators, and wound care treatments like Dakin solution, Santyl, Medihoney, and Silvadene. You'll also learn about oral vitamin C and zinc, along with nursing implications, safety tips, and proper application techniques for effective patient care.
Okay, so here's our game plan. We'll start with the stuff that fights off infections, then we'll move to calming down inflammation. After that, we are going to tackle wound care and skin prep, and we'll wrap it all up with the most important part, the critical safety checks you can never, ever forget. Now, before we get into the specific drugs, let's just lock in on why this is so critical. You know, the skin is your patient's largest organ. It's their main barrier against, well, everything. So your role in treating it isn't just about clearing up a rash, it's about protecting your patient's entire body. All right, let's get into our first set of tools. These are the ones you're going to reach for when you're up against the most common bacterial and fungal invaders out there. First up is a classic you'll see all the time, impetigo. It's a super contagious bacterial infection, and those yellowish, kind of honey-colored crusts, that's the dead giveaway. Seeing that is your first major clue. So when you see impetigo, your brain should immediately go to mupirocin. This topical antibiotic is designed to hit that infection right at the source. It's a really clear path from diagnosis straight to treatment. Okay, let's switch from bacteria to a totally different kind of invader, fungus. Tinea infections, which you've probably heard of as ringworm, look very different. You get that classic red, scaly border with a clearing in the middle. That's your big signal that you're dealing with a fungus. And your tool for this is clotrimazole, a really potent topical antifungal. But here's the thing. The most crucial part of this slide isn't just the drug, it's the timeline. You have to tell your patient that this is not a quick fix. Getting rid of it for good takes persistence, sometimes for weeks or even months. All right, let's switch gears. We've talked about fighting infections. Now, let's get into managing one of the most common and frustrating patient complaints, that relentless cycle of inflammation and itching. So, the proper medical term for itching is pruritus. That means any agent designed to stop that itch is called an antipyretic. And trust me, providing that relief is exactly what your patients are hoping for. The absolute go-to for this is a topical corticosteroid. Their power is really a 1-2 punch. They attack the underlying inflammation, and they provide that much-needed anti-itching relief. It's 2 birds, 1 stone. But knowing their limitations is just as critical. Corticosteroids do not relieve pain, they don't fight infection, in fact, they can sometimes hide an infection, and they don't help build new skin. Knowing what they don't do is absolutely key to using them safely and managing your patient's expectations. Okay, now we're moving into what can be the most complex part of our toolkit. We're talking about the agents used for advanced wound care. So when you're managing a wound, a big part of the job is debridement. That means removing the dead or necrotic tissue. Here you've got 2 very different choices. On one side, there's collagenase, an enzyme that literally eats away at that dead tissue. On the other, you have Medihoney, which works through a natural mechanism. Pay close attention to the differences in how you apply them, and most importantly, their risk profiles. Okay, now here are 3 heavy hitters for fighting infection in wounds. But I want you to focus your eyes right on that last column. Missing an iodine allergy before you use catechol or iodine, or a sulfa allergy before applying silver sulfadiazine, that can cause serious problems. These allergy checks are completely non-negotiable. All right, let's talk prevention. Before any procedure that breaks the skin, I mean anything from starting an IV to major surgery, proper skin prep is your #1 defense against infection. These 3 are the absolute workhorses of skin prep. You're going to see them everywhere, and for good reason. They work, and they work fast. You've got your standard alcohol, the super common chlorhexidine, and then povidone iodine, or betadine. And just like we saw with our wound care meds, betadine comes with a huge warning sign. You have to ask about iodine and even seafood allergies before you use it. It's a simple question that prevents a massive problem. And that brings us to the most important principle of all. This is the foundation of your entire practice, patient safety. And when you're using topical agents, safety always starts with asking the right questions. So picture it. You've got the medication in your hand. You've confirmed the doctor's order. Before you do anything else, what is the single most powerful safety tool you have? It's just a simple question. This checklist, it isn't just helpful. You need to burn this into your brain. Linking these specific questions to these specific medications is how you stop a serious, maybe even life-threatening reaction before it starts. Asking about allergies isn't just checking a box. It is a core professional responsibility. So, what's the big takeaway here? Mastering this topical toolkit isn't just about acing your next exam. It's about building the confidence to give safe, effective care at the bedside every single time. This knowledge literally translates into better patient outcomes. We've focused a lot on the what, the medications themselves. But I want to leave you with this thought about the how. The drugs are vital, of course, but your ability to educate your patient, to ask the right questions, and to build trust, that is the final and maybe the most critical tool in your entire toolkit. How are you going to make communication your most powerful instrument in patient care?